I'm about to start, is it okay?
Yeah.
Alright, let's talk about respiratory alkalosis. When I'm talking about respiratory alkalosis, I'm talking about alkalosis of the blood, which is that the blood has a high pH level. It's the opposite of acidic, and it's due to respiratory causes. So how do you know someone's in respiratory alkalosis? Well, as always with acid-base imbalance, you look at their pH, their CO2, and their bicarb. And so here, I have a video that covers this in more detail, but we'll do two quick examples. Here you see the pH is 7.50, which is alkalotic. The CO2 is 30, which is on the alkalotic side. And you have a bicarb of 24, which is within normal range. So the two that are on the, you look at the pH as alkalotic, which one matches? That's CO2. So since these are both on the alkalotic side, this is respiratory alkalosis. Another example, pH is 7.48, which would still be on the alkalotic side. CO2 of 28, again on the alkalotic side. And bicarb of 21. This time you see the bicarb is on the acidic side. Well, what matches the pH? That would be the CO2. So CO2 is respiratory, so this would be a respiratory cause of alkalosis. Alright, so what causes respiratory alkalosis? Hyperventilation or hypoxemia. What I mean by this is hyperventilation could be caused by anxiety, it could be caused by medication overdose such as aspirin, it can be caused by trauma to the head and the body that tells the body when it needs to breathe. If the patient is breathing lots of in and out, in and out, in and out, they're going to be expelling lots of carbon dioxide, and so what happens is their carbon dioxide levels are going to drop. So remember, carbon dioxide, carbon diacid. So carbon dioxide is acidic, and if you're getting rid of all that acid, you're going to become alkalotic. So hyperventilation is a cause. Here I also have hypoxemia. If someone's climbing Mount Everest and there's not a lot of oxygen in the air, and they're or there's any high elevation, for example, and they're taking lots and lots of breaths, trying to bring up their oxygen levels, they can at the same time be expelling lots of carbon dioxide. And as the carbon dioxide levels drop, carbon dioxide is carbon diacid, they become alkalotic. So what are some signs and symptoms? So both of these, you can see that the patient is having a lot of respiratory movements. So they're tachypneic. The respiratory rate is elevated. With all of these acid-base disorders, the patient's going to have dysrhythmias because the pH balance is thrown off whether it's up or down. So they're going to be having some dysrhythmias. And as you can see, the patient is either anxious, causing them to hyperventilate, or they're not getting enough oxygen and they're going to be anxious about feeling like they're suffocating. So you may see some anxiety. Now you'll see alkalosis, and we'll cover this also with metabolic alkalosis. What happens is the patient's going to have numbness and tingling in their extremities, and that will eventually lead to tetany and convulsions. And this just has to do with what the alkalosis does at the cellular level. So remember, with alkalosis, with both of them, numbness, tingling, tetany, and convulsions. And so how do we treat respiratory alkalosis? Well, you identify the cause and you treat the cause. So if the patient is hyperventilating because of high anxiety levels, you may need to do some anxiety reduction, whether this is through medicine or through behavioral therapy, or if they're in a psych ward, you need to treat them for that. You need to make sure you can reduce their anxiety. If their respiratory rate is elevated because they're low on oxygen levels, which all you have to do is check their oxygen saturations, and you see they're low, give them some O2 therapy, put them on nasal cannula, or at this case, if they're alkalotic, they probably need a face mask of some kind. And so what you want to do is identify or be aware that there's several causes of respiratory alkalosis, find out what the cause is, and then focus on the cause. So this is respiratory alkalosis.